So my name is Jessica LaBombard. I am the Marketing Communications Coordinator here at Onslow Memorial Hospital. And I have the pleasure today of introducing Dr. Safley, board certified surgeon at Onslow Memorial Hospital. And he's going to talk a little bit about our recovery plan and the state of the hospital during the COVID-19 pandemic. So Dr. Safley?
Yeah, so thanks for having me. It's my pleasure to really talk to you about how we're getting back to normal activity in the operating room at the hospital. And so, first I wanted to talk about sort of what was our initial response to the COVID-19 pandemic and sort of where we progressed from there. And so initially, the job of the medical staff at the hospital is really to keep patients safe, okay? Both the patients that have COVID-19 and also patients that don't have COVID-19, and sort of how do we keep them safe but also keep them separate. Mm-hmm. And then number two, continue to provide the ability to care for people that showed up to our hospital with emergency problems. Do you have a ruptured appendix? Do you have a fractured femur?
Continuing that care.
Right. And making sure that we, as the practitioners of the hospital, have the ability to continue to care for people who need urgent and emergent care. And then also how to limit the transmission of the virus, specifically within the four walls of the hospital, but also kind of limit its transmission amongst the community around us. Mm-hmm. And so initially what we had done is we limited the types and the number of cases that we were doing in order to preserve our equipment and make sure that we had policies and procedures in place to protect patients and hospital staff and everybody else. Eventually we were able to do that and implement a plan, because this has never happened before in modern medicine. And once we had the plan implemented, we have been slowly rebuilding the types and the numbers of surgeries that we are able to do, up to the point where now we're actually starting to do more elective cases. And I sort of use the term elective loosely. It's not that they don't need to be done, it's just that they're not emergency cases. So we kind of say, oh, is it an emergency case or is it an elective case? It's a very broad definition, but that's kind of what we're using right now. And so as of right now, June the 16th, 2020, we are doing more elective cases, okay? Now, as we have progressed through this whole process, we have started with people who have maybe not emergency situations, but very urgent or important situations like cancer, breast cancer, colon cancer, thyroid cancer, or lesions, like a mass or a tumor that we don't know if it's cancer or not. So those are the people that we've started with, and then we have progressed to, like I said, what we're doing today. Are things that are even more elective cases, like a hernia that somebody may have had for 6 or 8 or 10 or 12 weeks. Okay. The other people that are given preference right now are people who had their surgeries canceled during the pandemic. So if you had a groin hernia during the pandemic, okay, and it wasn't an emergency, but you needed to have it fixed, then what we would do is we put you off until regular operations resumed, and then those people were sort of given first priority when we started doing cases again. Okay. So that's where we are in terms of what types of cases that we're doing and why, how we're sort of slowly ramping up. We are keeping an eye on what sort of shortages people, our equipment has. So nationally, you've seen on the news nationally, even, UNC and Duke and some of those other people have talked, the bigger places have talked about shortages of masks or gowns or gloves. And so we've kept a very, very close look at how many of these, gloves and masks and gowns do we have, so that we ensure that we don't run out. If we run out, then we can't provide emergency care to those patients who show up with broken arms, broken legs.
Focus on that balance.
Exactly. And then the last sort of piece of the puzzle that's sort of an ongoing issue is how are we dealing with the patients that show up that have the COVID-19 virus. Okay. What we want to do is we want to keep them safe and give them appropriate care, but we also want to keep them separate from the patients who don't have it, because we don't want one patient giving it to another patient. That would be unacceptable. And so, we've instituted for people who are having elective surgeries, we are testing everyone that comes in for an elective surgery. Do you or don't you have the virus? If you have the virus or you test positive for the virus, we are delaying your surgery until you have gotten over the virus, okay? As long as that's safe, okay? You know, in an emergency situation, if you have the virus and we have to do surgery, then we take the appropriate precautions, you know, outlined by people like the CDC or the American College of Surgeons in order to care for those patients. And so, like I said, you know, there's a lot of, you know, quarantining, you know, actually in the hospital that we will do for those patients who have COVID-19.
Okay, great. Well, thank you for that overview. So prior to the Facebook Live, we did have some questions that came in via a survey that we put out. So one question was, how exactly are you separating COVID positive patients inside the hospital? Okay,
well, no, that's a good question. So right now, there is an entire wing of the floor, you know, one part of the floor that is roped off and margined off for people who are COVID positive patients. COVID positive patients. The nurses on that floor are, again, following the CDC guidelines in terms of what type of PPE or personal protective equipment they're to be wearing: masks, face shields, gloves, and gowns. Okay, you know, and so we keep, you know, all of those patients in that little area so that they're not mingling in with other patients in the hospital, and also make sure that those nurses are not traveling around the hospital as they're caring for those patients. You know, they go up to work, they wear their personal protective equipment. When they get ready to go home, they use appropriate hand washing and all that sort of stuff.
Protective gowns, sanitation.
Exactly.
Everybody. Yeah.
Exactly.
Okay, great. So another question we got is it safe to come to the emergency department? Like, if you need emergency care, we found a lot of people are concerned, you know, about catching while they're in the waiting room. Is it safe?
Absolutely. And so, you know, they have, you know, previously we employed a tent out front for people that we thought may have COVID-19. What we do is there are screening questions that try to identify people who are at high risk to having the disease. And especially in the ER, there's also a separate area of the ER that they're using for people that they suspect may possibly have COVID-19. And so, you know, people who are suspected to have it are put into their own little area. And again, when we can reasonably recognize that they don't have it, then they can be put up either on the floor. If they can't say, well, we're not sure that they are cleared, then they would go to one of the areas of the hospital that are designated for patients who may have COVID-19. Okay, but yeah, a trip to the emergency department is safe. They are keeping all of this in perspective, and it's always considered at every part of the hospital visit. So if you're coming to the ER, if you're coming for elective surgery, people are screened appropriately, and then you know, sent to one side of the hospital, one side of the ER, or another, depending on how the screening questionnaire is, how the results are from the screening questionnaire. Okay, great.
So a couple more questions. So are employees, what about employees? Are they screened? Are they required to wear masks? What's kind of their protocol?
Yeah. So actually, this has been several months now. Whenever all this stuff started. So the questionnaires that are actually given to patients are actually given to nurses and doctors and everybody. You know, radiology techs, everybody that sets foot in the hospital is given a screening questionnaire of really a variation, but the same types of questions that are given to patients. Okay. You have to pass the screening questionnaire before you're ever let into work. Your temperature is checked before you're let into work. And what they do is they've actually taken, you know, we have lots of entrances and exits to the hospital. We are only allowed to use 2 separate entrances and exits in the hospital for employees. And so if you're going to come in or go out, you are stopped at the door, and you're, again, screened before they let you in and let you come to work. So questions, temperature, and then, you know, the nursing staff is expected to wear masks while they're in the hospital and treating patients.
Okay, great. And anybody has any questions, if you're watching live with us today, if you have a question, please feel free to insert it in the comment bar, and we'll make sure to answer it as well. Okay, so another couple questions that came in, because we have quite a few. So if I had an elective surgery scheduled and it was canceled, how and when should I go about rescheduling it?
Okay, well, that's actually a really good question, and like I said, we've been sort of working through that for about the last month or so. But what it is those surgeries that were canceled have been tracked by the operating room and also by the physician's offices. And so what happens is that people that were canceled, as soon as we were allowed to sort of go back and start, scheduling these patients, between the OR schedulers and the physician's offices, those people have been then put back on the schedule. Like I said, some people were given a higher priority, people that had cancer, people that had, the potential for life-threatening problems were sort of given a little bit higher priority. But all those patients that have been canceled have been given the opportunity to put their cases back on. Now, in my own personal experience, some of those patients want to have their surgery as soon as possible. Some of them are busy taking care of their families and stuff during the pandemic and say, well, no, I'd really like to delay my surgery for another month or so, and they're given that opportunity. But as of right now, there was, believe it or not, there was actually a backlog of about 200 cases over that, that about 6 or 8 week period that we were holding off and trying to sort of get our footing with this whole thing. I think that most of those cases have either been scheduled or have been already performed over about the last 3 to 4 weeks. And so, we're really working on sort of mobilizing those surgeries and trying to get them done so that we can move on to more elective cases that are also needing to be done.
Okay, great. So you're starting to work through all of that backlog of cases and getting all of those rescheduled.
Mm-hmm.
Wonderful. So another question. So what if my surgery was canceled, but my condition has gotten worse? But it hasn't been rescheduled. What do I do?
Well, that's a great question. So there are people that let's say I'm a general surgeon. I do hernia surgery, gallbladder surgery. Let's say you were scheduled for your gallbladder surgery, and it's now been scheduled for late July because that was the first time we could get you on. If your symptoms are worsening, you have two options. You can either, talk to your doctor. You can call my office or the doctor of your office, and tell him, hey, by the way, my symptoms are worsening. I can't hold anything down. I can't eat. I can't drink. I can't live like this. There is the possibility of us rescheduling you sooner if the situation has changed. Okay. The other option would be if you're having a medical emergency, you should go to the emergency room, and that way you can get taken care of immediately, right? So those are the two options. If it's something that, well, we're going to try to get you sooner, and you can wait a few days, you can always contact your physician. If it's something that's a medical emergency, or you're having extreme difficulty, fevers, chills, nausea, vomiting, whatever's going on, if it's progressing and getting worse, a trip to the ER may be the quickest way to get you taken care of.
Right. We don't want anybody to obviously avoid seeking health care if they need it, just
Correct.
because of COVID or anything.
Correct.
Those lines. We want people to come if they need it.
Exactly. And let me also say too that the pandemic is significant, and we don't want people to kind of take it lightly. But at the same time, we don't want people to avoid normal health care, right? I mean, you need to, if you have a problem, please go to your doctor. If you're due for a colonoscopy, or if you're due for a mammogram, or if you're due for a pap smear, please seek out those the processes and the testing and the procedures that are going to help keep you healthy. Okay, one thing that we have seen is that people are staying at home longer and they're actually getting sicker, and that doesn't help you and it doesn't help us. It makes the physician's job harder. It makes your course a little longer. It makes your course more difficult. So if you're having a problem, please seek out that help. And like I said, be assured that doctors' offices are being cleaned appropriately. CDC guidelines are being maintained and they're being met, and those are also being done at the hospital as well.
Great. Let's see. So if my surgery has been scheduled, but I think I'm having symptoms of COVID-19, what do I do?
Well, right now the protocol that we have at the hospital is if you think you have COVID-19, you can call your doctor's office, or you can call the number at the hospital. I don't have that number on me, but yeah, it's all over the website. If you call the operator, it's on the message from the operator at the hospital. That's the resource center that will tell you exactly what you need to do, right? So there are people who, that's all they do all day is talk to people about their COVID-19 symptoms. And so that's, I would get get in contact with those people who have been tasked with maintaining that.
Okay, great. So does anybody else have any questions for Dr. Safley, either about our surgery plan, or about COVID-19, or about the hospital? Check really quick. Is there anything else you want to say or talk about, Dr. Safley?
No, I would say that, everybody needs to wear their masks, follow the CDC guidelines, and try to stay safe,
So we did have one question come through,
Okay.
And they would like to know about visitor restrictions.
Okay. Well, that let me back up by saying visitor restrictions are unfortunate. Nobody wants to have to leave their loved ones at the hospital, but especially initially, where we didn't have a really good handle of what was going on, it was necessary. At this time, I'll be honest with you, the visitor restrictions have changed a little bit. I don't know all of the policies. Okay. What we can do is we can get a hold of all of the policies. Each one of the floors or different parts of the hospital do have different policies. So the policy for the OR is a little bit different from the ICU, is a little bit different from the floor, is a little bit different from radiology. What we can do is we can get a hold of all of the policies and maybe post them on the website or post them to Facebook. But understand that that the restrictions that we put in place are not because anybody wants to restrict it. It's for safety reasons. It really is. It really is for the patient safety. It's for employee safety, and it's for visitor safety.
Yes. So in all of our visitor restrictions, you can kind of see how they've evolved over time based on our hospital policy, UNC policy, and CDC guidelines. Those are all available on our website, which is onslow.org, so you can review those there. And then as we have updates for our visitor policy, we always share those on our Facebook page and our website to keep you updated. Okay. Let's see, are there any other questions? In a minute. Okay, well, if anybody thinks of any other questions that, spark an interest later on today or tomorrow, down the road, certainly add those in. And we thank you, Dr. Safley, for taking time to talk with us today. I know you've just been swamped and everything's kind of been picking back up. So we appreciate you being here and talking about the recovery plan and the hospital. And after today, we will have all of these questions and the answers available both on our social media page and our website, as well as the recording of this video. So thank you, and I hope you all have a wonderful day.
Thanks.